Alright, let's dive into this explosive debate that's been simmering in India's healthcare system. Imagine a world where a homeopath can legally prescribe antibiotics. Sounds nuts, right? But that's exactly what's happening in Maharashtra, and it's tearing open a massive rift between two medical philosophies. Today, we're unpacking why this clash between homeopathy and allopathy isn't just about medicine. It's about power, economics, and the future of healthcare. Buckle up. Let's start with the basics. Allopathy, modern medicine, is what most of us know: surgeries, pharmaceuticals, peer-reviewed studies. Homeopathy, it's the like cures like philosophy, where a tiny bit of poison ivy might treat joint pain. They're fundamentally different systems. But here's where it gets wild. In 2014, Maharashtra let homeopaths prescribe allopathic drugs. Why? Rural areas were starving for doctors. But this isn't just charity. It's a power move that's sparking outrage. Now, the homeopaths' argument. They're saying, look, we're handling 80% of primary care anyway. Why shouldn't we have the legal right to use modern meds for basic issues like infections? On the surface, that makes sense. If a village has one doctor and it's a homeopath, you'd want them to save a kid with a snake bite using antivenom, not just sugar pills. But here's the catch: their training. Allopaths spend 6 years studying pharmacology, anatomy, and clinical practice. Homeopaths get a 1-year crash course in modern pharmacology. Personally, I think this is where the debate gets messy. Can a weekend warrior really match the expertise of a seasoned chef? Or are we risking patient safety for convenience? Then there's the IMA's stance. They're screaming, "This is quackery." And honestly, it's hard to ignore their point. If homeopathy's core philosophy rejects material doses, why suddenly embrace antibiotics? It feels hypocritical. But wait, let's not pretend allopaths are saints. The source calls out IMA's dictatorship when they prescribe Ayurvedic meds themselves. Double standards much? What this really exposes is a deeper tension. Modern medicine sees itself as the gold standard, but it's failing rural India. Over 800 medical colleges now, yet primary care is collapsing. Why? Because allopaths chase specializations or flee abroad, leaving villages in the dust. So, is Mixopathy a solution or a scam? Let's talk money. The source drops a bomb. 80% of homeopathy colleges are owned by politicians. That stinks of cronyism. Are we legalizing this to fix healthcare or protect investments? And the insurance angle? AYUSH treatments now qualify for coverage, which sounds progressive, until you realize it's a $644 billion global alternative medicine market. This isn't just about healing. It's about profit. Meanwhile, hospitals fear losing their workforce of homeopaths who currently work under allopaths. Translation: big pharma and private clinics have skin in the game. What's the bigger picture? This debate isn't just Indian. It's global. We're watching two paradigms collide: reductionist science versus holistic tradition. But here's the thing: modern medicine isn't perfect. It's arrogant. It dismisses centuries of herbal knowledge but steals turmeric and willow bark aspirin when convenient. Conversely, homeopathy's evidence-based claims are shaky. Their central council exists, but how many double-blind studies prove a sugar pill works? If they want legitimacy, they should publish or perish like everyone else. So where do I land? I'm torn. On one hand, rural patients deserve real care, not ideological purity. If a homeopath can save a life with an antibiotic, more power to them. But on the other, shouldn't we fix the root problem? Train more allopaths, invest in infrastructure, stop using healthcare as a political chess piece. Allowing mixopathy feels like slapping a band-aid on a broken bone. It's a temporary fix masking a rotting system. What do you think? Is this a pragmatic solution or a dangerous compromise? Drop your thoughts below. Let's turn this comment section into a town hall. And if you're hungry for more hot takes on medicine, hit subscribe. Next week, we're diving into Big Pharma's dirtiest secret. See you in the chaos.